Hello, welcome to this video on medical nutrition therapy in diabetes. Diabetes is a metabolic disease, therefore, apart from what medications to be given, you should also know what diet you should advise to the patients, what kind of exercises you should advise to the patients. This video will cover carbohydrates. So, what are the important carbohydrates? How much carbohydrates a patient can take? What is glycemic index? What is glycemic load? Because diabetes is high glucose in the blood, understanding about carbohydrates is very important. This video is very important. So, how much carbs should be taken? Should you restrict it completely, or is there any acceptable level of carbohydrates that can be taken? So studies have shown that if the carbohydrate percentage in the total meal is less than 26%, it will reduce the HbA1c level, it will improve the lipid profile. But what about very low carbohydrate diet? Is it very useful? The studies are inconclusive. So in initial 6 months of study, they found that it actually reduced glycated hemoglobin levels. But on long-term follow-up, there was no much significant difference. However, very low carbohydrate diet is not recommended in pregnancy, in lactation, in children, and people on SGLT2 inhibitors. So why is it not recommended in pregnancy, lactation children? It's very obvious. It will affect the development and growth of the child. And what about people on SGLT2 inhibitors? So people on SGLT2 inhibitors have a risk of dehydration. And now upon dehydration, if you ask them to restrict glucose to a very low level, they might end up having ketoacidosis. So to prevent ketoacidosis, very low carbohydrate diet is not recommended in pregnancy, lactation, and people who are at a risk of developing ketoacidosis. Now, irrespective of how much carbohydrates should be taken, you should always ensure that the patient is taking good carbohydrates. The majority of the carbohydrates should come from vegetables, from whole grains, not the processed grains, and fruits. There should also be good amount of fiber intake. For every 1000 kilocalories, there should be at least 14 grams of fiber intake. What type of carbohydrate should not be taken? This is very important. If you have a patient, right, who has diabetes, the first thing they'll say is, doctor, I have stopped taking sugar. But if you check further, they'll say, instead of sugar, I'm taking jaggery. No, sugar, jaggery, nothing. Honey, nothing should be taken if they are diabetic. Then processed and food grains should also not be taken. Sugar sweetened beverages, the Coke, Fanta, anything sugar sweetened. So the carbohydrates or the sugars for the body should come from the vegetables, fruits, and the whole grains. No added sugar is required for a body. Now, glycemic index is very important. It will actually tell you if any patient takes any food. So how fast the glucose raises in the blood, the glycemic index tells about it. It assesses how quickly carbohydrates are digested and released into bloodstream following their ingestion. How do you measure it? So he is Mr. A. He is a happy Mr. A. What do? You give 50 gram of carbohydrate that you want to measure. The Mr. A will eat it. Now, for the next 2 hours, you will measure Mr. A's blood glucose levels. Okay? For the next 2 hours, you will continuously measure the blood glucose levels of Mr. A. Now, in next time frame, maybe after a day, after 2 days, in different time frame, you will give 50 grams of glucose to Mr. A. Now you do the same thing again. So you will measure the blood glucose levels following this. Now, the area under this curve. This is the area under this curve. This is area under the curve of glucose. This area divided by this area will give you glycemic index. So now this is converted into percentage. This is how. So you will compare the postprandial rise of glucose levels with your test product or the test carbohydrate with that of postprandial rise of glucose with the glucose itself. Then you will divide area under curve of both and convert it into percentage. Factors affecting glycemic index. What are the type of carbohydrate? If the carbohydrate is very easy to digest, it will raise the blood sugar very high and the glycemic index will be high. On the contrary, if it's a complex carbohydrate where the body needs to work a lot to digest it, it will raise the blood glucose very slowly and this will have lower glycemic index. Protein and fat content. Protein and fat content as such do not contribute to glucose levels in the blood, like raise of glucose levels in the blood. So if the protein and fat content in the food is high, then it will reduce the glycemic index. Type of fiber. Water soluble fiber delays the postprandial rise. I'm telling you, it delays. Water soluble delays. pH of the food. More acidic, lower the glycemic index. Type of carbohydrate. Complex has lower glycemic index. Then protein, if the protein and fat content is more, the glycemic index of the food reduces. If the type of fiber, if it is water soluble, even then the glycemic index is low. Then pH, more acidic the food is, lower the glycemic index is. Cooking time. What happens if you overcook anything? The complex carbohydrates, the complex things present in the food, it might be converted into easily digestible things, easily digestible components, which might increase the glycemic index of the food. So increased cooking time might, it's not always, but might increase the glycemic index of food. Okay, increases the glycemic index. Now foods and their glycemic index. The highest glycemic is rice and rice items. Anything made from rice, be it like pulao, biryani or anything. Or it can be in terms of the breakfast like dosa, pongal. All those have high glycemic index. Puffed rice. Apart from that, white bread, sugar, jaggery, these all have high glycemic index. The glycemic index is divided into high, moderate and low. So anything more than 70 is called as high GI, high glycemic index. 56 to 69 is moderate and less than 55 is low GI foods. So you should always counsel the patient to substitute high GI foods with intermediate or low GI foods. For example, if a patient is dosa addict, right? You can tell, instead of using white rice, the patient can use brown rice, quinoa or barley in their dosa. Same thing with pongal, same thing with appam and rice items like biryani, pulao, anything. They can substitute white rice with brown rice or barley or quinoa or any whole grain. Then they can also opt for intermediate like moderate GI, which have GI between 56 to 69. They can have wheat chapati, idli with sambar, onion dosa, curd rice, poha. So instead of puffed rice, right, you can tell the patient to have poha because this has a slightly lower glycemic index. Sabudana, upma, oats. So all these have, just remember that any rice with rice item, rice or made of rice, biryani, pulao or dosa or pongal, white, sugar, jaggery, they all have high glycemic index. Okay, then patients should restrict this. They should shift to intermediate or low glycemic index foods. Fruits. What are the fruits that has to be avoided? High glycemic index is present in chiku, watermelon. Moderate as banana, jackfruit, papaya, mango. You can tell, for the diabetic patients to reduce the intake of these: banana, jackfruit, papaya, mango, chiku and watermelon, because these have high GFs. They can have seeds. Seeds have lower glycemic index, like flax seeds, chia seeds, pumpkin seeds, sesame seeds, and dry fruits. In dry fruits, very good dry fruits are almonds, apricots, walnuts. These three dry fruits are really very good. They are not only low glycemic index, but they are also a good source of unsaturated fatty acids. You can ask the patients to take these seeds, they can, and take these dry fruits. Then in the Indian, you can ask them to have apple, guava, orange, musambi, pomegranate, and all this. So remember, apart from these six fruits like chiku, watermelon, banana, jackfruit, papaya, mango, patients can have nuts, patients can have seeds, and patients can have other fruits. Vegetables, same thing. Potato, pumpkin, tapioca has high GI index. So they can shift to moderate or low GI index foods. So instead of rice, white rice, they can shift to millets, which we discussed, or they can even shift to, in Indian scenario, it's easy for them to shift to ragi or jowar than shifting to quinoa, shifting to brown rice, because these are more, they seem very common. Then they can have ragi, jowar with all these vegetables, like carrots, corn, green beans. These are really very good foods. They have very low glycemic index, very good for the body. It has a good fiber content. It will also meet the demands of fiber, like per 1000 kilocalories. Glycemic load. One of the important disadvantage of glycemic index is it doesn't take into account how much carbohydrate the patient has taken. I'll give you an example. Consider low glycemic food, maybe intermediate to low glycemic chapati. Chapati is a low, it has intermediate glycemic index, but if it is taken like more than required, then the blood sugar that will be raised following this intake is very high. On the contrary, there might be some food which has high glycemic index, but the amount of carbohydrate present in 100 gram is very less. So even if you eat some amount of it, it will not actually raise the blood glucose levels. This was the problem with glycemic index. This glycemic index was not taking into account the amount of carbohydrate a patient is ingesting during a particular meal or particular time. This disadvantage has been taken care by the glycemic load. So glycemic load takes care account of both. So GI of the food and amount of carbohydrate taken. How do you calculate? GI, glycemic index, into how much carbohydrates the patient is taking, divided by 100. It is divided into 3. Low glycemic, if the score comes less than 10, it is called as low glycemic load. If the score is between 11 to 19, it is called as intermediate glycemic load. And if the score comes more or equal to 20, it is a high glycemic load. I'll give you some more examples so that it becomes very clear for you. This is a tata, this is a 70-year-old tata, and he wants to eat a bowl of watermelon. So GI index of glycemic index of watermelon is 72, and one bowl roughly contains 16.1 gram. Now what is the formula? Formula is glycemic index into carbohydrate the patient is taking divided by 100, right? So it comes to 72 into 16.1 divided by 100. How much it comes to? It comes to 11.59. Is it low glycemic load? Is it intermediate, or is it high glycemic load? It is intermediate. So now, although watermelon has high glycemic index, one bowl of watermelon will have intermediate glycemic load. So you can tell the patient, rather than taking one bowl, the patient can shift to 3/4 bowl. Right? It's not like the patient has to completely avoid it. You can actually tell the patient quantity of how much he can take it. Now this is the second. Hey, this is a patient known case of diabetes, and he wants to eat chapatis. Okay. Now, the GI index of chapati is 66, which comes in the moderate range. Okay. What is moderate? Anything between 56 to 69 is moderate. Chapati comes under it. Two chapatis have roughly 35 gram of glucose. Now, what will be the glycemic load of this patient? 35 into 66 divided by 100. Let me just see, 35 into 66 divided. It comes to around 23. What is the glycemic load now? Is it low? Is it intermediate or high? It is high. Right? So now what you should tell the patient, don't eat 2 chapatis because it will raise your blood sugars very much. Rather than having 2 chapatis, you can have 1 chapati. Why? Because if the patient has 1 chapati, it will roughly come to 12.5 in the middle range, not high, not low. This is the importance of glycemic load.